Mr. Speaker, yesterday the Minister of Health boasted about the government's Healthy Child Committee, which is a mini-cabinet of 10 ministers presided over the Minister of Children and Youth Opportunities. This mega committee is not effective. There's been no improvement. The extent of alcohol consumption during pregnancy and the number of children diagnosed with FASD are not going down. I table Figure 8 from the government's own report. I asked the Minister of Children and Youth Opportunities, what specific measures is he taking to reduce the high level of alcohol consumption during pregnancy in Manitoba?
Mr. Speaker, I want to thank the member for the question. First off, I'd like to talk about the report where he got his information, the Healthy Child Committee of Cabinet, the first of its kind in the country, Mr. Speaker. Of course, we're committed to research and data and evaluation, Mr. Speaker, and that's why he's able to reference the material, Mr. Speaker. Also, we're committed to making that report public, Mr. Speaker, so our community organizations and people in our community can actually get that information, Mr. Speaker. Some highlights from that, I know the member said that there wasn't improvements at the prenatal stage. There's been improved access to care before 6 months. New mothers, we've seen increased high school graduation. There's been, with our prenatal benefit, there's support for mothers from low income, a healthy baby weight, our Families First Home Visiting Program, Mr. Speaker. So, Mr. Speaker, I'm glad that the member was able
to use...
Order,
please. The minister's time has expired.
Mr. Speaker, I thank the minister for the report, which was well done. But the fact of the matter is that the report shows that there's not been the progress we should have. Indeed, high rates of alcohol use during pregnancy contribute not only to FASD, but also to Manitoba's high infant mortality rates. As this this piece that I reference, table shows, the evidence is clear. The government's mega committee is not effective. In contrast, smoking during pregnancy started going down only after there was an all-party task force on environmental tobacco smoke which recommended effective changes. I asked the Premier, will he consider calling an all-party task force...
Order, please. The member's time has expired. Order, please. The member's time has expired.
Thank the member for the question. The all-party task force on tobacco consumption was a useful exercise, as was the all-party task force on healthy kids. We have seen a decline in smoking in Manitoba. There is a correlation between the cost of cigarettes and the consumption of cigarettes, and we have seen a dramatic decline in the consumption of tobacco in Manitoba. If the member has any good ideas, we're very open to listening to them and finding ways to work with him as we move forward to make sure the health outcomes for all young mothers and all young families improve in this province and indeed across the country by the interventions we take.
Mr. Speaker, the fact is the mega committee is not working, despite many, many questions from the Liberal Party over the last decade with regard to FASD. The number of children identified with FASD is not decreasing. The cost, Mr. Speaker, of each child with FASD is estimated at a lifetime cost of $1 million per child. And I table this. With an average of 100 new children being diagnosed with FASD each year, and that's not a complete number, the cost of FASD to Manitobans from this government's inaction is now more than $1.3 billion. I ask the Premier, will he call today an all-party task force into reducing alcohol...
Order, please. The member's time has expired.
Mr. Speaker, FASD is a scourge for any family that experiences it and any young child. There's no question about it, which is why we did put an FASD strategy in place, and which is why Manitoba is the site of global research on FASD. One of the things that's being done under the Canada-Israel Committee for Health is to take a look at how we can do path-breaking work on FASD. And the prenatal benefit is a solid foundation for that with the home visiting program that's done by Nurse through the Families First program. We are finding that with proper nutrition, we can reduce the incidence of FASD in families, which is why the visiting program and the prenatal program have made a great difference and are looked at around the world as very good interventions. If the member of the leader of the Liberal Party has any other suggestions, we'd be happy to work with him on other ways we can improve outcomes for these young families, because there's no doubt we can make improvements in Manitoba and will make improvements in Manitoba, Mr. Speaker.